Hi, I'm Patrick Martin from the Mental Health Toolbox, and in this video, I'm going to teach you how to find a therapist. So I'm creating this tutorial because as a therapist, a psychotherapist, I understand the challenges from the consumer's perspective and how difficult it is to sometimes get help and where to start and also how to navigate your options because it's not always clear. Some people think you have to go straight to a county clinic. You might just Google therapists near me. But that's not usually the most effective way to go about it. And as a therapist, I often find myself helping consumers or potential consumers navigate their options a lot more efficiently, especially because in my full-time job, I work with a county clinic. And so oftentimes, depending on the needs, we have to refer out. And so out of necessity, I've become rather savvy at helping clients figure out that logistic. And I've been wanting to produce this tutorial for a while, but one of the reasons I haven't is just getting my setup and one thing at a time, between the podcast and the blog and other stuff. This was further down my list, but I'm glad to get started. But especially because right now with the whole COVID-19 pandemic, telehealth has really become top of mind. It wasn't really something that a lot of people, it wasn't on their radar as much, and it was even a little bit taboo because I think it was just not orthodox in the therapy world. But I started a private telehealth practice actually just before this whole COVID-19 thing started. So I got my feet wet, got a little jump start on it. So I understood on this end a little more what that looks like, which I think puts me in an even better position to help you out here. But yeah, with the COVID-19 situation, there's been a lot more traction. So in that way, I think it's been really good. And one of the benefits that comes out for this is the access to mental health services and the mental health awareness, I think, is one of the big things we're going to take away from this. And I think because of it, you're going to see a lot more accessibility, a lot more programs, insurance companies, platforms like Therapy Notes, Theranest are really going to be pushing it a lot more. As a Cigna consumer with my insurance, I know I receive a lot of emails really pushing telehealth now, and I think that's just really cool. Okay, so let's go ahead and get started. So I'm going to pull up my file here, and I'm going to be walking you through 13 different directories for finding a therapist. And the first and foremost that I think you should probably know about is Psychology Today. Now, Psychology Today is also known as a magazine for mental health, articles, good stuff. But it's also a database. And this is what I believe and what I've found to be the number one source across the nation where private therapists will market themselves. So it's kind of a one-stop shop in that regard, but it's not the only directory. And so I'll be walking you through some other options as well. Okay, so this is good for finding both face-to-face and online. And when I refer to tier 1, that means you can get medication. So that would be like a county clinic or someplace with a psychiatrist or nurse practitioner who can prescribe medication. Tier 2 generally refers to just your psychologists or your MFTs or LCSWs or your LPCs, basically your straight therapists. Only doctors, MDs, psychiatrists, and nurse practitioners can prescribe medication. So depending on your needs, I'm going to walk you through a couple of options, okay? So let's go ahead and start off with Psychology Today, okay? So the first thing you'll notice, and if you just jump onto Google here and I just tell people type in Psychology Today Therapist Finder, and you'll get this screen here. So we're just going to jump on down, and you'll see a couple things here. So if you look down here, you'll see California, right? So you can actually search by state. And this is important because when we're looking at telehealth options, you have the entire state at your disposal. So rather than being tied down to a specific location, therapists who offer online therapy can practice in the entire state in which they're licensed. So that gives you a whole lot more options, right? If there were only 10 therapists that accept your insurance in your zip code, if you're looking at a brick and mortar place, that's really going to limit your options. But if you have the entire state, man, it's going to be a lot easier to shop around, which can also be a little overwhelming. But when it comes to your preferences and your needs, it's going to be a lot easier to hone in on what works for you. Okay, so let's just start by looking at California as an example. So if you just click on the state, you'll see all the therapists in California that you have an option with. And so the list, would just go on and on. But the nice thing about this, if we're just looking at online therapy to start, is over here on the left side, you'll see, and this might look different on your mobile device. It'd be a little button that says refine up on the top right of your phone. But if you're on a desktop like this, at the top here, you'll see your insurance options. That's if you have insurance like Cigna or Blue Cross. And if you click that button, for example, let me show you. Let's say I click Cigna. Now you'll see a little bubble under their name that shows they accept Cigna. Pretty cool. And the other thing you'll notice is online therapy. This tab was kind of hidden before, but with everything going on, Psychology Today has really amped up their game for the telehealth and made it really apparent, a lot easier to find. So we'll just click online counseling. And there you go. So you have another bubble that says online or phone counseling. Some insurance companies are allowing just phone sessions as opposed to video, whereas telehealth usually refers to video chat. Okay. But you have Cigna and online counseling. But let's say, okay, so I found an online counselor, but what I really need help with is trauma or addiction, right? Or ADHD. That would be right here under issues. You can narrow it down a little bit further, or let's say it's eating disorders. Very specific, right? Well, now you have an online therapist that takes your insurance that specializes in eating disorders. So now you can see how this comes in real handy when you start to filter out your needs. You can even niche it down further if you need to. Let's say that you primarily just wanted to see somebody who has the same faith as you, so you want a Christian counselor or somebody that understands your faith base. Well, there you go. Christian counselor specializes in eating disorders, who takes your insurance and has online therapy. Pretty cool. Once you find one that looks like you would want to explore further, you have a few options. So if you click on their profile, let's take Vicky here. And this is new right here, where it says, this little mic, this little volume symbol. It's a little added something that Therapy Notes is doing right now that allows therapists to make a little statement about their online options or something they really want to call out, get your attention. Okay. So a lot of these therapists also practice brick and mortar. So you'll see their address location here. And this is their profile, which is nice. And I would encourage you to scroll down. And this is really, you'll get an idea of a few things. One being the cost per session. Let's say you were to pay out of pocket, and you'll see, wow, that's a big range, like $50 to $200. That's pretty substantial difference. Well, that's because you'll see here it says they take sliding scale. So most therapists will hold a few spots on their caseload for low-income clients, and they'll offer them a much lower rate out of pocket in order to make it more accessible. Okay. Also, you'll see if they accept insurance. You'll see all the plans they're on. So these could be HMOs, it could be Medi-Cal, it could be Medicare. And then that will mean you can most likely bill your insurance, and insurance usually doesn't mind. They usually have a behavioral health package, with their little co-payment. In most cases, I don't think Medi-Cal has a co-payment. But like Cigna, probably like $10, $20, depending on what your plan is. Some insurance companies do have a deductible you have to burn through first. And sometimes that's just for primary care, but sometimes it also includes a deductible for mental health. So you definitely want to check with your insurance carrier on that. Okay. And make sure you know before you, or even, you can have your therapist follow up for you if you don't want to. That's what I usually do. I usually call on my own and just confirm with insurance companies if that's the case. Okay. So you can see what kind of specialties they have experience in, maybe special certification, or maybe those are just the areas they have the most experience in. So that's worth noting. You'll see their license number is here, so it's legit. All right. And so that's definitely, oh yeah, and additional credentials. So if they have any other like equine assisted psychotherapy. So that would mean like working with horses. I guess that makes sense with the picture, right? Equine therapist. And you can see she's from Marietta. So I know Norco is big horse country nearby there. So good stuff. Okay. So let's say you find some therapists that interest you. One of the big problems that I find clients run into, and this is what I ran into when I've tried to help clients find a therapist if I'm linking them, is that oftentimes when you go to call a therapist, you just get their voicemail. That's because they're most likely in session and so can't answer their phone unless they have a big enough, practice where they have an answering service or a virtual assistant or somebody that will take those messages and screen them on their behalf. So what I usually encourage prospective clients to do is to both call, leave a message, but also you'll see this email me feature on Psychology Today. So if we click on that, you'll see it's just a little, not too invasive here, just your name, email, phone number, subject, and a message. And I really encourage you to use the email feature because it just makes getting a hold of your potential therapist a lot easier. Plus, you can do the copy paste thing because the chances are the first therapist you pick won't get back to you right away. So what I usually do when I'm sitting with a potential client and I'm referring out is I will have them copy and paste like 10 of these, to like 10 potential therapists. And that makes it a lot easier to get a call back sooner from somebody. Okay. Yeah, and the therapist will go straight to their email that's linked to their Psychology Today account. I do encourage in the message area that you put down the insurance that you have and your plan or group number and your date of birth. That way the potential therapist can vet your insurance before they call you back. So you don't have any hiccups. Nothing's probably more discouraging than getting excited about working with a therapist and then find out that they can't take your insurance or there's some hiccup, right? Very frustrating. So save yourself the work on the latter end and just provide your insurance information here in the email, and your prospective therapist can check that out ahead of time. Okay. The other thing I would have you look at here is there's usually a website button. Yeah, right here. So there's a website button you can click, and that will take you to the prospective website of the therapist where you can dive in a little bit deeper. They might have a blog. You can learn more about their thought process or their background, how they work. Very handy, right? And also sometimes they provide group services as well. Even right now, I know there's a lot of traction building with even telehealth groups. Pretty cool. So you can email, you can call, and just keep in mind the phone number that's provided here. That is a third-party number. It's a Google Voice number, so don't feel weird when you call and it says Google Voice, because that's provided by Psychology Today as a free third-party number that forwards the calls to their private number or business number. Okay, so the number you get a call back from will probably be a different number than the one you called. So keep that in mind. Might even be a blocked number, so just be aware. Okay, so jumping back here, I wanted to point out a couple other things too. So you'll see it'll keep going even after your insurance is selected. You'll eventually reach a point where it says it'll keep offering therapists, but it won't have your insurance that you picked, that you selected, available anymore. So it does cut off at some point based on availability, but it'll still make recommendations. Okay. So I did mention tier 1, tier 2. So Psychology Today is mainly for tier 2, so therapists, psychologists. But it does have a little feature down here at the bottom of the filter. You can select psychiatrists and treatment centers and support groups. So that's a nice little add-on for finding a psychiatrist that accepts your insurance if they're listed on Psychology Today. And so there are some, and I'll just X off a couple of these filter options so I can show you what I mean. I'll get rid of online therapy. We'll keep the insurance, so we'll keep Cigna. We'll get rid of eating disorders. So we just have the insurance selected, and then we're going to jump down and click on psychiatrists. And then you'll see there are some doctors on here, But interestingly enough, we have to reselect the insurance. So you notice the bubble went away. So before you get too excited, I want you to reselect the insurance to see what's around. Okay. And there you go. So you have psychiatrists that take your insurance. But the thing is, remember, we started with the state. So what we need to do now is we need to drill down, because psychiatrists are most likely going to be a brick and mortar unless they are offering online options. They're going to want your zip code. We could click on here to see if there's online psychiatrists. Telemedicine, there you go. Cigna and telemedicine. So lots of options there, which I think is great, because a lot of times doctors have only been accessible in the brick and mortar setting. But I think with everything going on right now with COVID-19, that you're seeing a lot more options. So that's great. But let's say COVID-19 is over. It's, we're not having the stay-at-home order. You want to see someone face-to-face. So then that's when you'd punch in the zip code. So if we just put in, for example, 91006, that's Arcadia, California, near Pasadena, then it's going to show you doctors in Arcadia. But guess what? Now we have to select the insurance again, I believe, or maybe there are no Cigna doctors in the area. Sometimes the insurance won't show. But we have Arcadia, and we have Cigna, and we have psychiatrists selected. And so there you go. The nearest one would be Eastville, California. Not very close, right? So Santa Ana, California. Now we're looking at Orange County, Huntington Beach, Orange County. So you might have to do a little traveling if you're looking for a psychiatrist. So same thing though, you can email, you can call. So you still have options in that regard. And if you don't have insurance, of course, I'm sure there's out-of-pocket options. But in California anyway, most everybody either has Medi-Cal or they have an insurance. I will say this, something that's not known very well is that if you have Medi-Cal, especially in California, obviously, then there's the third-party insurance that's attached. So a doctor may not say they take Medi-Cal, but they might say they take HealthNet. And so there is HealthNet Medi-Cal, or there's Anthem Medi-Cal, or there's LA Care Medi-Cal, which is actually Beacon. And so some insurance companies I have found make a big, distinguishment between their third-party Medi-Cal versus insurance as like an HMO kind of thing. And I've noticed that HealthNet doesn't really make that discrepancy too much. So if you have HealthNet Medi-Cal, it's probably easier to find a doctor as if it was an HMO, even though you have Medi-Cal. So that's a little interesting tidbit that you may not have known about. So that's how psychology today works. You can find doctors. If we looked at support groups, usually support groups don't regularly take the insurance or bill the insurance. Sometimes they do. It depends on the therapist and how they structure that. Okay. But you'll see the insurance disappeared up here when I selected groups. And that's because a lot of the time the groups are open to the public, support groups, and they just charge per head out of pocket. But oftentimes you can find therapists that can still bill the insurance. So you have to check with a specific therapist in that regard. But groups become really handy when you're looking at something like dialectic behavioral therapy. So I'll select that in the types of therapy. Because DBT it requires a group modality. It's group and individual. And so you can't really get around that. And so oftentimes I'll have clients say, I need a DBT program. Where do I go? And this is one of the easiest way to find them in the community is going through Psychology Today, DBT, support groups, and there you go. But again, there might be some associated out-of-pocket cost. That's not unusual, but you may be able to finagle insurance to pay for it. Another note, if you don't have insurance and you want to start treatment, there's something called a super bill. And you can ask your therapist for a super bill of expenses you've paid for out of pocket for treatment. And then you can submit that super bill, which basically states the diagnosis, mode of treatment, the therapist's information. And you turn that into your respective insurance or Medi-Cal. And oftentimes, even though it was out of network, they will reimburse you a percentage of the amount that you paid for out of pocket. It's usually roughly around 50% that I've seen. So that's something worth noting. And since it's COVID-19 and all, they may even be willing to pay for more. So that is definitely something to explore, and that's called a super bill. If you are finding yourself stuck and you have to pay out of pocket, that's one way to go. But I'm also going to show you a directory for low income. So we've only touched on the first of 13 directories, but I wanted to spend a little more time on this one just because A, it's the one I'm most familiar with, and B, I think it's the most robust option that you have. Okay, so now let's go ahead and jump back over to the list. And the next one on the list here that I've typed up for you is BetterHelp. So BetterHelp is online only. It's one of the most popular kind of mobile friendly online telehealth resources. And one of the nice things about BetterHelp is there's not very much friction with getting started. They make it very easy. They'll match you to a counselor that you can go through the questions with you. Let's say looking for depression, and they ask if it's individual, couples, or teenage. So let's just say it's individual. And this is BetterHelp. They ask your gender. I'll just say it's male. How old are you? We'll just call it 30. I don't know, whatever, 29. And then what is your orientation? I don't know, we'll just say straight. Religious, we'll just say no. Spiritual, we'll say no. We'll say no, or we've never been to counseling before. And then, and kind of what your goal is. Let's just say manage my depression. So then it takes you into this line of questioning, which it doesn't say, but it's the questions that follow here are known as the PHQ-9, Patient Health Questionnaire. You've probably filled it out in your doctor's office, and it gives a baseline for depression. And they do the same thing if you choose anxiety. They go through the GAD-7, which is General Anxiety Disorder Questionnaire, just to kind of get a summary of the symptoms that match the diagnosis to get a severity. And then that gives them an idea, which I think is really great. I mean, I think most therapists do this at intake now. I do it when I do my intakes, the PHQ-9 and the GAD-7 to get a baseline. But I think it's really cool that they're doing this as an initial contact through the website. I think that's really ingenious. And after this, after you fill out all the questions, then it will try and match you down to a therapist that meets your needs best, which I think is really cool. So that's BetterHelp. All right, next one. TheraLink. TheraLink is a service that provides their own video chat platform to therapists. Now, they do have an online directory. They are online only. But the thing about TheraLink is their directory is very small right now. And that's why I started off with psychology today, because a lot of these other therapy directories are very limited. And so we have, we click on directory here. What are you looking for? Choose a category, all religions, or search by specialty. We'll just say anxiety. And then you can select by region and so forth. But like I said, the options on the directory are pretty slim. You'll get like 2 or 3. If you select like psychotherapist, it won't be very much, but it's growing. So that's another resource you could try if you want. Okay, third thing. eCounseling.com. This is one I didn't know about until I started doing the research for this tutorial. And eCounseling.com is actually a lot larger than I would have expected. So let's go with Arcadia again, 91006, Arcadia, California. And it gives you quite an exhaustive list. Now, I think the premise here is that it's assuming you're interested in online therapy. But a lot of the therapists listed on here are not exclusively online therapists. And this actually pulls from other websites like BetterHelp or maybe Psychology Today. And it will list therapists, and you view the profile here, and then it breaks it down for you. So you look up here, BetterHelp, right? At the top. So she's with BetterHelp. So again, that's online only, but I don't think all the therapists are strictly online only. But anyway, I'm rather impressed with the amount of therapists that are on here in this directory, but I do think it might be a little more lacking in terms of the whole matching to insurance and that kind of thing, which you find with Psychology Today. Okay, moving on. Number 5. So Good Therapy. Let's take a look at that one. It's BetterHelp, Good Therapy. Find the right therapist. Okay. So Good Therapy, they have a blog, which is always kind of cool. I appreciate that. That way the consumer can read up on mental health issues, related stuff, get a little more well-versed. It always, I think, improves the quality of therapy when you are well-read on the subject. So find telehealth, or find a therapist, find a facility, or find an event. I really like that at the get-go because then you can just kind of hone in on what you need. I like that it defaults to telehealth, especially with everything going on right now. So just select a state, and it takes you from there. Very nice. And I love the filters on the left here. It feels very much Psychology Today-ish, the way they've outlined things like insurance, type of service, common specialties. And so it has a very similar feel, and it looks rather robust as well. So Good Therapy looks like a good resource. So if you run into a wall with Psychology Today, I would probably swing over to Good Therapy next. Okay. All right, so OpenPath, you'll notice here I put sliding scale. So OpenPath is designed for low income, and every therapist on OpenPath directories, I think, required to offer at least one slot for the cheaper option. I think it's $30. So on here, you'll find both face-to-face and online options. So I'll just show you what that looks like on OpenPath. Now, the only caveat with OpenPath is it does require an annual fee for the consumer, and I think that is because that's how they stay in business. But it's $59 or something like that to get started for the year, and then they match you up to a therapist. So that's kind of cool. Same kind of filter. You have your, you can do in-person or online. So in-person search field right here. Online search field down here. So if we just select California and hit submit, let's just see what happens. Okay. So 593 therapists. I like that it tells you how many. 593 therapists match your search criteria. So from here, you could probably, yeah, it's nice. It tells you if they're accepting new clients, which is always nice because you don't want to go through all the hassle of finding one, calling to finding out they're full. And obviously, they all say online therapy available because that's what we searched for, but I like the little icon here that says that as well. Very neat. So you can, very much like Psychology Today, you can email them or you can look at their profile. And here you'll see individual counseling is $30 to $60. Now that is the core benefit of OpenPath, is it's designed to be easier on the wallet if you're paying out of pocket. Okay, and even couples therapy, which is usually substantially more than individual therapy, at least by $20 or so an hour, is still reasonable in the 30 and up range, which is great. All right. Very cool. Very cool. Of course, it says modality. They work with just adults or children, individuals, couples. Expertise, experience. So typical profile like you'd see on Psychology Today. Very cool. I'm impressed. All right. So the next one is Therapy Den. This one offers face-to-face and online as well. Options. Therapy Den. So again, specialty, zip code, insurance. Very nice out the gate, asking you if you have a particular insurance, so you don't have to hunt later after you're into the directory. So specialty, substance abuse, adjustment disorder. We'll just say anxiety. This time we'll search Glendora zip code. We'll say, for fun, we'll say Aetna insurance. Okay, so this gives you a nice overview of the maps. So if you're familiar with the area, then you can definitely orient yourself. I like this little tab up here because you can toggle between online and in person. So I think that's pretty neat. So you can kind of compare apples to apples here in terms of your options. And then it gives you a list as opposed to the map view because we're not looking at brick and mortar. This makes sense. So very cool. I like it. So Therapy Den, I like it. I like the layout. It's very clean. Seems easy enough. It's very important, I think, to be user-friendly when you're talking about mental health platforms, directories, referral sources. ZenCare. So I marked this one as Tier 1 and Tier 2 because they offer both Tier 1, which is medication, so psychiatrists, as well as just straight counselors. All right, so let's take a look at that. And I remember when I was reviewing this, I was really impressed with how clean the homepage is. Why are you seeking therapy? Or where are you seeking therapy? We'll just say Los Angeles. And some of these newer sites kind of just limit it to the major urban cities here. We'll say search. 29 results. So again, you can select by insurance, budget, provider type. So here you get to pick between therapist or psychiatrist, which I love. So again, if you're needing both therapy and medication, you may have to maybe get a therapist through one source like psychology and then find a psychiatrist by picking around at one of these other sites. If you can't find out psychology today, you might have to go somewhere else. So ZenCare looks like a winner. Very cool. All right, I like it. You know, one I didn't mention on here was ZocDoc.com. So I'm just going to punch that in right here. ZocDoc.com. ZocDoc.com. Okay. Let's go back to ZenCare. So I'll just jump back here to Google. So we're just going to type in ZocDoc. And it's very similar. So ZocDoc is often used to find primary care or dentists, but I think what a lot of people know is you can find psychiatrists on ZocDoc as well. And the nice thing about this is you can actually schedule your appointment straight through the website. I help clients with this all the time when they're trying to find primary care doctor because you can just select Medi-Cal or whatever insurance, primary care, see right here, PCP, and your zip code, and then you can actually just go through the prompts. You can review the doctors and their background profiles, and you can actually see their availability calendar and just schedule your intake appointment right through the website, which I love. So I've always been a fan of ZocDoc since I first learned about it. Been referring to people for years. It makes my job a lot easier to link because a big, part of my job as a therapist is linkage, and ZocDoc makes it really easy. So just say psychiatrist 91006 Arcadia, and we'll just say, oh, I have Medi-Cal. This part's not super easy, but it works. We'll say Medi-Cal LA Care. That's popular in this area. And here you go. You have doctors, psychiatrists that take Medi-Cal LA Care, and then this is their availability. And look, this is new. Video visit. That wasn't there before. The whole COVID-19 thing. So I really like that. And so if you were to follow this, well, you could look at his profile too. Get reviews. You can see where they went to school, if they have any privileges at hospitals. NPI number, in case you want to vet them a little bit. You can see, usually they have more than one location. This guy's got 3. You can look at the reviews, see what their medical specialty was, internist, etc. And medical school outside of mental health. And it's pretty cool. And so once you decide that you want to go with a doctor, then you can just pick the appointment time. It'll walk you through the intake. You can do your intake forms through the website. And then it doesn't cost you anything. It's a free broker service. And then the office calls you pretty quick to verify insurance. And that's that. So I like ZocDoc a lot. Very, very cool. Okay, moving on. So SAMHSA, or as I say it, probably mispronounce that, SAMHSA is a government site that I find very useful. It's more useful for finding clinics, right? Let me jump back. Find treatment. So you can look for substance use treatment locators or behavioral health. So that's why I like this website, because it's the Substance Abuse and Mental Health Service Administration. So dual diagnosis is a huge thing. And you might be struggling with recovery from addiction as well as mental health. And dual diagnosis programs would be most appropriate in that sense, or at least finding 2 solid programs for each. In this area, Social Model is really popular, dual diagnosis program that takes Medi-Cal. But for example, if we just wanted to find behavioral health, we would click on that. You'd put in your zip. We'll use Arcadia again. All right. Search facilities. Now this one gets a little busy, so it's not so easy on the eyes, but it is a really neat tool, right? So you see how it's a little overwhelming, all the dots, but you'll see first thing is Arcadia Mental Health Center. That is a county directly operated mental health clinic. So that is straight LA County mental health, Medi-Cal, or low income. And that's what this site's really good for, since we're looking at county clinics and agencies, mostly in contracted facilities. Most of them are going to accept Medi-Cal, okay, or something similar in your, depending on where you are. Pacific Clinics, that is a contracted clinic with DMH. So a lot of these are. BHC is actually, Alhambra is a psychiatric hospital. So you can, if this is a little too much to tease through, up here, you can actually select, unselect substance use and mental health, just select mental health, and then you can even drill down on that more and just look at outpatient only. So it's not super user friendly, but you can thumb your way through it if you need to. But that's a good website, especially if you are low income or have Medi-Cal and you're looking for a county operated clinic, because they are both tier 1, tier 2. And that's the main reason clients seek county services, is their financial status, but also because they need medication. And that is one of the, a lot of time your primary care won't prescribe antipsychotics, at least not long term, or even antidepressants long term, because it's kind of outside of their scope. And sometimes the only place you can find those services is with a psychiatrist at a county facility when you don't have private insurance. So every county should have their own mental health website. That's another way you could go about finding a county clinic. In this case, I used LA County as an example. And you usually just type in like LACDMH or something like that. You can type the whole thing out if you wanted to. So this is LA County Mental Health website. The nice thing about it is they have a DMH provider directory. You could go that way to the quick link, or you could just come up here to our services, and then you drop down to adults, click on that. Unless you have children, if you're looking for services for children, you could select kids and children's system of care. This is the adult system of care, and over here, where it's on this box, search box, where it says mental health programs and services, you would just punch that in there. If I put in 91740, the Glendora area, it'll give you your local options here. So again, this one's a hospital, Glendora Oaks Behavioral Health Center. That's a psychiatric hospital. Pacific Clinics is an outpatient. Specialized foster care doesn't really apply. And this is another one you might want to filter out by outpatient only, because it does give you some information that may not be immediately relevant. So East San Gabriel Valley Mental Health Center would be the closest directly operated mental health center to that zip code, and so forth. I believe there is a way to filter this out by service. But going through your local county website for mental health is always a safe bet if you're low income, but it's not your only resource, and that's why I'm showing you all of these different directories so that you are well informed and equipped, because the consumer should have the right to shop around and figure out what is best for their needs, especially at a time like this when mental health is going to become even more paramount with all the stress we are in on a global level, that shared experience of COVID-19. So if you want sometimes you can just find faith-based directories. I stumbled on this one. It's called Christian Counselor Directory. So if, just like in Psychology Today on their directory, you can select the faith, but if you know for a fact you just want like a Christian counselor or something like that, this website is pretty legit. I think it's clean, and its design. So that's there. If you want to find just Christian counseling, there's probably different directories for different religions, I'm sure, with technology being what it is. And lastly, if you just want like couples therapy and you know that's what you're after, you could go through Psychology Today and just look at couples family therapy. But there's also directories that just target couples therapists. And I thought this one was kind of cool, but it looks a little new too, just because the limited cities that are at your disposal. But we can select California, see where that takes us, and then Los Angeles. And yeah, you'll see you're a little limited here. This doesn't tell you anything about insurance, etc. So it's probably a newish directory, but I want you to have several options. So I think this would be good to have. Plus they have articles for couples, which is cool. I'm always big on articles written by other therapists because they're very informative. And I think whatever you can do to empower yourself is a really good idea. So there you go, couples therapists. So just as to reflect, Psychology Today I think should be your first stop shop, because you can find both Tier 1 and Tier 2 services, so psychiatry and psychological services, therapists, LMFTs, LCSWs, etc., PsyDs, PhDs, as well as psychiatrists. You can find groups, you can find specific insurance needs, skill sets, etc. So, what was it? Yeah, so let's see. So that's me, for example. And something else I wanted to point out to you, I think I had mentioned, let's see, I click on this, the website, right? So if you want to learn more about your therapist, you can swing over to the website. You can also share this with a friend. If you know a friend struggling with mental health, you can use Psychology Today and just shoot this over to their email if you want to refer them to a therapist. And when you're depressed and you're anxious, a lot of the time it's really hard to find the energy and the critical thinking to do this kind of footwork. And so it's perfectly fine to ask a friend or a family member to help you search for your options. Okay. Another thing you can do is call NAMI. Let me see. NAMI they have a referral line for mental health. You can call the county referral line in your area. For LA County, it's Access 1-800-854-7771, and they can always assist with finding you the right resource. And at the bottom of my website, I had listed resources. The National Suicide Hotline is always good to know. They have a text feature now as well, 1-800-273-8255 or start 741-741. But the NAMI referral helpline is 1-800-950-6264. Excuse me. So you have a lot of options here. There's a statewide helpline for California, 1-855-845-7415. So there's certainly no lack of help and resources when it comes to mental health. But what a lot of people don't know is where to start. And so I would encourage you, if you're just shopping around, try Psychology Today. And that's probably the easiest, cleanest way to go about it. But I think with this whole COVID-19 thing going on, we're going to see a whole lot more options in that regard. Okay? So until next time, stay safe and stay healthy. Take care of yourself. Make good things happen. And this is another tool for your toolbox. Please do share it if you find this useful. Like and subscribe to the channel. I'm trying to get my YouTube channel up and running so I can help everyone out the best I can. In addition to my podcast, really just trying to raise mental health awareness. So please, if you find this helpful, please do share it, like and subscribe, and let me know if there's anything you would like me to speak to directly, and I would be happy to assist and put something together for you. Okay? If you prefer to listen as opposed to watch, do check out the Mental Health Toolbox podcast. It's on all the major platforms, Apple Podcasts, iHeartRadio, etc., Pandora. So please do. All right, until next time, make good things happen and take care. Bye-bye now.